I presented two clinical trials, our CD19 chimeric antigen receptor clinical trial in pediatric ALL and B-cell lymphomas, as well as a GD2 CAR T cell trial for primarily osteosarcoma with a few neuroblastoma patients. So our first trial, the CD19 CAR T cell trial, was quite pivotal, as has been several of the other trials at the other institutions in the U.S. At present time, we have data on 46 patients, children and young adults, with refractory relapse leukemia, mostly. And we give them a single dose of the CD19 CAR T cells after, most often, a light chemotherapy prep regimen. And we had a 60-65% complete response rate that was an intent to treat analysis. The intent to treat analysis allows us to account for every single patient that we have enrolled, and every single patient that we did enroll had detectable disease at the time we treated them. And so I think that that's really across the board. When you look at multiple institutions, people report different response rates, but in reality, I think they're all about the same. Importantly, in our study, one of the key findings was that we could quite reliably and effectively treat leukemia that had gone to the spinal fluid or even the brain. We had 5 patients with such disease. 2 were quite extensive disease in the brain and the spinal fluid. And we were able to safely and effectively eradicate CNS leukemia as well as systemic leukemia with a single IV infusion or intravenous infusion of the CAR T cells. The CAR cells migrate to this brain and spinal fluid and kill off tumor there. So really that's quite important because there's not been another effective therapy to treat CNS leukemia in the past 30 or so years, when we still are using multiple doses of intrathecal chemotherapy with or without high doses of radiation, all of which have bad chronic side effects. So this is a completely new modality of treating CNS leukemia, so it's quite exciting, and without apparently any lasting toxicities at this point. I recently moved from the pediatric oncology branch at the NCI, where these trials were conducted. The GD2 CAR T cell trial at the NCI treated 12 patients with osteosarcoma, which is GD2 positive, and 2 patients with neuroblastoma, which obviously is also GD2 positive. And we're still enrolling patients, so the final data analysis is not out. We had to start at very low doses of cells because we were quite concerned, given the experience with the GD2 antibodies in neuroblastoma, of neurotoxicity. We were quite concerned that we would generate a severe neurotoxicity in these patients. So we started with very low doses, and we've incorporated a suicide vector in the CAR itself, which allows us to give an inert drug that would kill off all of the CAR T cells should we run into extensive problems. That hasn't happened yet, and we haven't had to test it. And at the most recent higher dose levels, we're starting to see some expansion of the CAR T cells and some cytokine release syndrome, which has been the hallmark of efficacy in the CD19 CAR experience. So extrapolating from that, we think this is active, but importantly, we have not seen any neurotoxicity whatsoever in these patients. The CD19 CAR T cell trial we had at the NCI was independent of pharma, and with my departure, we closed that protocol. We actually still have a CD22 CAR T cell trial, which is a first-in-human trial being done in pediatrics, which is a rarity these days, that a first-in-human trial is being done in pediatrics in anything. But that's still open and enrolling at the NCI under the guise of Dr. Terry Fry. And the GD2 CAR trial, we're still enrolling, and we'll see how active it is as we get to these higher dose levels, and how promising that looks. There might be, for other reasons, it might be advantageous to incorporate different motifs in the GD2 CAR, because in general it's harder to treat solid tumors than the leukemias and lymphomas, and you really need an extra push for the cells in order to get effective therapies, I think. And it's just unclear as to what that extra thing might be. So that's an active area of ongoing investigation.